How do you manage a flare-up or a setback? What's up everyone, I'm Dr. Nate. I'm going to be talking about how to manage flare-ups and setbacks, which are really the same thing, in relation to lower back pain or other injuries. When you have a flare-up, it can feel like you've taken a step back, hence why people usually call it a setback too. And you might be, I had this experience the other day actually. One of my clients, she came in and she was sharing that 2 days ago she could only walk for about 15 minutes, or actually less than that, like 8 minutes, before she had to sit down, rest, let the pain calm down, and then allow her to walk the rest of the way. This was like one block around her neighborhood. And then the following day, she was able to walk for an entire 15 minutes without having to rest, with like no symptoms whatsoever. So her question to me was, how in the world am I getting set back when I can't walk that full 15 minutes? Does this mean that I'm stepping backwards? And the answer is no. So sometimes we can do a little too much, or on certain days our body just might not be responding as well to exercise as we would hope it would. And so there are going to be good days and bad days when dealing with lower back issues and other persistent pain issues. And the goal is to string together more good days than bad days. And as you do that, you can really start to solidify more positive feedback patterns. So if you string together a few good days, it's likely that you're going to have more of those good days. So that's a big portion of understanding flare-ups and setbacks. When you're having a flare-up, what to do. Step one, do not panic. If you panic and you allow the anxiety to take over, it's done, right? Like, it's done. Like, there's nothing that you can do that's going to really make a big difference there. So that's important step number one. Number two, figure out a few different things. It can be movement, whether it's walking or yoga, or lying in a certain position, a heat pack, ice pack, TENS, specific medication. Like, there's all these different things to manage those flare-ups once we have controlled the anxiety that surrounds a flare-up. So that's really important to take into account. You need to plan that you will have some flare-ups, because it will happen. If it's not today, it's going to be in a few months, and just accepting that that's part of this process. So figuring out and having a list, you can write it out. Write out a list of things that make you feel good. And ideally it's not drinking copious amounts of alcohol. Ideally it's not taking a bunch of pain medication, because those are not the best ways to manage this. I know that some people do that, but honestly it's just not healthy. So figuring out more healthy ways to manage flare-ups. Please like this video, subscribe to my channel. You can also join my free Facebook group by clicking the link in the description. If you have any video requests, please drop them in the comments. How do you manage flare-ups? I'm just curious. Have a strong and resilient day, and I'll catch you on the next video.